Welcome to the University of Colorado Hospital. We want to guide you for your visit to the Epilepsy Monitoring Unit. If you have any questions, you can visit the information booth at the entrance of the Anschutz Inpatient Pavilion. The Epilepsy Monitoring Unit can be located by taking Elevator D. Once at the 7th floor, check in at the desk. They'll escort you to your room. Nurse Kristen will tell you some of the rules about your stay.
My name is Kristen. I'll be your nurse today. Nice to meet you. Welcome to the Neurosciences Unit. So if it's okay, I'd like to go over some of the rules with you. I see that you've brought your service animal. We totally respect that here. A few guidelines would be you need to have a friend or family member that can take the animal downstairs to use the restroom and can feed them. Also, we like to make sure that the animals are well behaved, not growling or barking at staff or acting aggressively in any way. We are a smoke-free campus, so that means no smoking and no e-cigarettes while you're here for your stay. Marijuana use is also prohibited at the University of Colorado Hospital. This includes vapes, creams, lotions, edibles, or any form of marijuana. If you do bring it in, we'll ask that it's sent home with a family member. You brought your medications with you. I'm gonna have the doctor take a look at them all, and then when they're done, I'm gonna have a family member or friend take them home for you, unless we specifically ask you to keep a particular medication. You're wearing your button-down shirt that opens in the front. That's great, so it looks like we're ready to begin getting you hooked up to the EEG today.
My name is Sige.
Hi, CK.
I am one of the EEG technologists here at UCH. I'm going to put the EEG on you today. I'm going to start with the head measuring, and I'm going to put 25 electrodes in your head, 2 electrodes in your chest for EKG.
So Christian, now I'm going to be starting an IV on you. We require that every EMU patient has an IV. We typically keep them capped and don't use them unless we need to give you medications while you're here. We want to keep you safe while you're here with us in the EMU. We consider all of our EMU patients to be high fall risk, and we'll be keeping you on a bed alarm for your safety. If you do need to get out of your bed, please call a staff member. You can do this by hitting your red button here. This will call a nurse or a CNA, and please wait for us to come before you get up to use the restroom. I see you have on your non-slip socks. That's great. That will help to keep you safe here too. I know it may be a little embarrassing, but we do want to keep you really safe, and that includes being with you while you're in the bathroom. So if you do need to use the restroom, the nurse or CNA that's accompanying you will have to stand within an arm's length of you while you use the toilet.
During your EMU stay, activation procedures will be performed. Dr. Brown will explain what procedures we will do and what you can expect.
While you're in the Epilepsy Monitoring Unit, our main goal is to have you have your seizures in as safe and an efficient way as possible. There are 3 main activation procedures which may be used while you're in the monitoring unit: hyperventilation, photic stimulation, and sleep deprivation. With sleep deprivation, we'll ask you to stay up for longer than you're typically used to doing at home, and the next day we'll wake you up at the usual time. This will give you a higher chance that you will have a seizure during your stay. Hyperventilation will have you breathing at a fast rate for a specific period of time, usually 3 minutes. With photic stimulation, we'll have flashes of light for a specific period of time, which the technologist will help you with. And for all of these procedures, except for sleep deprivation, the technologist will be in the room with you. During your monitoring unit stay, you will have an event button. If you feel any of your typical events, whether they be auras or seizures, please push the event button. It is never wrong to push the event button, and you can never over push the button. Many patients have more seizures when they decrease the amount of medications that they're taking. Your provider may recommend that you decrease your medications while you're in the epilepsy monitoring unit to make sure that seizures happen. However, it is very important that you continue to take your medications until instructed to stop by your neurologist, our seizure nurse, or your provider in the Epilepsy Monitoring Unit. We have a standard set of questions that the Epilepsy Monitoring Unit staff will ask you each time you have an event. These questions are a way of checking to see what you can or cannot do during an event, and can help our providers determine where in your brain your seizures start. There are no right or wrong answers. Our Epilepsy Monitoring Unit has a multi-person, interprofessional staff caring for you during this admission. What this means for you is that your care will be provided by combinations of epileptologists, specially trained advanced practice partners, residents, and medical students.
Our goal is to take care of you at the Epilepsy Monitoring Unit. If you have any questions or concerns, please ask any staff member. And thank you for choosing the University of Colorado Hospital.